With a gymnastics mat beneath them, the athlete begins by kicking up into a wall-supported handstand, with the arms fully extended overhead, the abdominals engaged, and the head, shoulder, hip, knee, and ankle in one straight line. Before lowering the body, ensure the shoulders are abducted to around 180 degrees. People will have a slightly different angle due to how they want their base of support. Have around 60 degrees of scapulothoracic joint upward rotation, elbows fully extended, and wrists extended to about 80 degrees. The athlete lowers themselves down until their head reaches the floor. During this lowering, the triceps are working eccentrically. The muscles that put the shoulder into a stable, externally rotated position are also working eccentrically as they release. These are the infraspinatus, teres minor, and with some help from the supraspinatus and the posterior deltoid muscle. As the athlete pushes themselves back up, they are concentrically contracting the abductors and external rotators, while simultaneously contracting triceps brachii to establish elbow extension. The serratus anterior, upper, and lower traps are also working to upwardly rotate the scapula. Ideally, there would be no extension in the spine during this exercise. The model here is not in ideal position and could demonstrate this better by engaging her abdominal muscles. This is a very complex movement that requires gradual progression. Once the athlete can support at least 80% of their body weight on a barbell overhead, they may begin practicing the following progressions. An athlete should also practice isometric handstand holds against a wall to build stability and practice proper body positioning. As the athlete increases stamina in the handstand position and feels comfortable, they may start working on lowering themselves and pushing back up. It is recommended that the athlete starts with a small range of motion. As strength improves and form permits, the athlete may begin increasing the range of motion. Another scaling option is working negatives, eccentric only. If the athlete elects to work on negatives, they should only perform a few reps at a time because it requires kicking back up into a handstand for each rep, and eccentrics increases delayed onset muscle soreness. Two common faults are hyperextension through the lumbar curve, which increases the compressive forces on the spine. The athlete has failed to co-contract the abdominals and erector spinae muscles. And slamming their head. This increases the chance of concussion or cervical spinal injury. This happens when an athlete can't safely lower themselves.